Ozempic, Wegovy, and Mounjaro. You've probably seen the TV commercials or heard celebrities talking about taking these drugs to lose weight. The FDA just approved a new drug called Zepbound. These drugs also help people with other health problems like diabetes and heart disease. But they're controversial because they cost more than $1,000 a month. And when it comes to insurance coverage, benefits experts tell me it's forcing employers to make a moral decision. Kate Moore is president of Employee Health and Benefits at Marsh McLennan Agency, a subsidiary of Marsh, the largest insurance brokerage in the world.
So we are helping HR departments figure out what benefits to offer their employees.
Moore says the claims data she tracks shows increased spending the last 18 months on the injectable drugs Wegovy, Ozempic, and Mounjaro.
So what's happened is there's been a lot of overprescribing to individuals who really aren't in those disease codes or states that we've described: diabetes, heart, obesity. So if you have all of these weight loss drugs going to individuals who don't really need it off, as you say, off label, then those patients that need it haven't been able to get it.
There are a lot of individuals who are pre-diabetes, who are overweight, and their doctors are creating justification for them to take it.
Is that wrong?
That's a really good question, because physicians have the authority, the legal authority, to prescribe any FDA-approved drug for any indication.
The point of these medications is to improve cardiovascular health.
Dr. Mike Miedema with the Minneapolis Heart Institute says new research on Wegovy, released last weekend at an American Heart Association conference, shows why doctors are turning to these weight loss drugs more often. In a 5-year study of more than 17,000 people who were overweight or obese and had heart disease, Wegovy sharply cut heart attacks, strokes, and cardiac deaths. And people also lost weight.
And so with weight loss, we see reductions in blood pressure, we see reductions in blood sugars, we see an increase in good cholesterol, and we see a decrease in triglycerides. All those things improve cardiovascular risk, and that's how you improve cardiovascular health.
But prescribing a medication and receiving it is different than whether or not your insurer has an obligation to pay for it.
KSTP medical expert Dr. Arkel Giorgio says people being overweight or obese is the biggest public health problem the U.S. has.
Kevin, this is a really big issue because over 65% of the American population is overweight or obese, and a big chunk of them could benefit from this medication that costs $1,200 a month. And at the same time, if everyone that needs it got it, we would bankrupt the healthcare system. So there is a dilemma here. What do? It is what we need, but it's too expensive.
So what position does this put employers in?
Employers are really struggling to decide, do they cover these drugs for weight loss?
Moore calls it a moral choice.
When I said moral choice, I think is, as an employer, if you care about your employees, you're going to do the best you can to cover what they need. But there is the affordability. It's this fine balance.
I suspect that all or most employers cover these medications for diabetes. That's not the dilemma. The dilemma is, do they cover these medications for weight loss?
So what will it take to bring the cost of these popular drugs down?
My hope is that this is going to be a huge dilemma and a huge stressor in the industry with patients, with doctors, until the medication is transitions to being an oral medication, pill form, which is cheaper to manufacture.
I just read an article yesterday in the New York Times that there's 70 weight loss drugs in the pipeline. So when those start to go through trial and start to be approved by the FDA for weight loss, you're going to start to see Wegovy go down in price. And again, those that are similar to the diabetic, you're going to see Ozempic and Mounjaro come down. So it's competition.
And now there's a little more competition. Eli Lilly says Zepbound will be on pharmacy shelves after Thanksgiving. Lilly and Novo Nordisk, the company that makes Ozempic and Wegovy, do offer discount cards to help people pay for their medicine, but the amount depends on whether your company offers insurance coverage. And one final important note. Dr. Mike Miedema says these drugs are not a magic potion. They work best when paired with extensive lifestyle changes like diet and exercise. Lindsay?
Kevin, this is a conversation going on all over the place, so great way to shed light on it. Thank you.